Modern medicine is remarkably efficient at managing symptoms until you're dead, but it's absolutely pathetic at keeping you alive and fully functional. If you've spent any time in the healthcare system, you've realized it's more of a sickness management industry or disease care system. They'll give you a pill for your blood pressure, a shot for your pain, and a pat on the head for your fatigue. Meanwhile, the underlying cause of your decline, the slow, agonizing starvation of your cells, is ignored. Why? Because you can't patent oxygen. I've spent the last several decades studying the physiological mechanics of aging. I didn't do it to become an influencer or to sell you some wellness theater jade egg. I did it because I'm obsessed with the biological truth. And the truth is this: your cells are dying for oxygen, and your body's plumbing is too clogged to deliver it. If you're looking for EWOT therapy in Sarasota, you'll find a few options, but most of them are the equivalent of a spa day for your ego. At ARTC, we treat oxygen like the high-octane fuel it is. We don't just let you sit there. We use exercise with oxygen therapy, EWOT, to force your system to reset. The short version is simple. You wear a mask connected to a massive reservoir bag filled with 90 to 95% concentrated oxygen while you perform light to moderate and at times higher intensity exercise on a stationary bike or rowing machine. This isn't your grandma's oxygen bar. The science version is where it gets interesting. Normally, your red blood cells, hemoglobin, are already about 98% saturated with oxygen. Breathing extra oxygen while sitting still does practically nothing because those red blood cells are already full. However, when you add exercise, you create an oxygen demand in the tissues. By breathing a massive surplus of O2 during that demand, we take advantage of the law of mass action. We force oxygen to dissolve directly into the plasma, the liquid portion of your blood. When oxygen is dissolved in the plasma, it can reach areas that red blood cells, which are relatively large, simply cannot squeeze into. We call this superphysiologic oxygenation. It's the difference between a trickle from a garden hose and a pressure washer cleaning out your internal pipes. Your microcirculation is the network of tiny capillaries that actually deliver nutrients and oxygen to your cells. As you age, these capillaries don't just get old, they malfunction. Due to inflammation, poor diet, what I call fake food, and lack of proper stimulus, the endothelial cells lining these tiny vessels swell up. When the vessel walls swell, the hole in the middle gets smaller. Eventually, it becomes so narrow that red blood cells can't pass through. Your cells are literally starving in a land of plenty. This is why your healing slows down, why your brain feels like it's wrapped in wet wool, brain fog, and why your skin starts to look like a crumpled paper bag. At ARTC, we focus on the microvascular health assessment to see exactly how compromised your system is before we start the pressure wash. That's one reason EWOT therapy Sarasota patients pursue here is built around actual physiology instead of recycled wellness fluff. You can't fix what you haven't measured. When we put you on an EWOT protocol, we aren't just giving you a breath of fresh air. We are performing a capillary flush. By driving that dissolved oxygen into the plasma, we provide the energy required for the endothelial cells in your capillary walls to finally settle down and stop swelling. This is the part most people miss. They think oxygen delivery is just about stuffing more oxygen into the lungs and hoping for the best. Cute idea. Wrong. The Bohr Effect is a basic physiological principle stating that when carbon dioxide, CO2, rises and tissue acidity increases, hemoglobin becomes more willing to release oxygen. In plain English, exercise increases metabolic rate, your muscles burn more fuel, and they produce more CO2 as a byproduct. That CO2 is the chemical signal telling hemoglobin to stop hoarding oxygen and release it into the tissues where the work is actually happening. That matters because hemoglobin is usually a little too attached to its oxygen. Like a bureaucrat guarding office supplies, it doesn't always let go when you need it to. But during exercise, the environment changes fast. Metabolic rate increases. CO2 production rises. Local acidity increases. Hemoglobin shifts toward oxygen unloading. Now combine that with EWOT therapy in Sarasota. While exercise forces hemoglobin to unload oxygen through the Bohr effect, the reservoir system is simultaneously increasing the partial pressure of dissolved oxygen in plasma. That creates a kind of pressure force delivery into the tissues. Hemoglobin releases more oxygen into active tissues. Plasma carries additional dissolved oxygen deeper into the microcirculation. That's the point. Not wellness, not hype. Physiology. You are using exercise-driven chemistry plus concentrated oxygen pressure to push more usable oxygen exactly where it's needed. As the swelling subsides, the capillaries dilate. Blood flow returns. This isn't a one-and-done miracle. It's a systemic reset. It takes repetition. You need to remind your body how to dilate those vessels and keep them open. This is why we integrate EWOT with our other protocols, such as weight loss, regenerative joint injections, sexual health enhancement, including ED, hair restoration, and peptide therapy Sarasota programs. In plain English, EWOT Therapy Sarasota clients start here to improve oxygen delivery to help improve the results of everything else that we do. If the delivery truck, your blood, can't get to the house, your cells, it doesn't matter how expensive your groceries, peptides, are. Mitochondria are the engines of your cells. They take oxygen and nutrients and turn them into ATP, adenosine triphosphate, the universal currency of biological energy. If you have low energy, you have a mitochondrial problem. Period. Mitochondria run on oxygen. When oxygen delivery drops due to poor microcirculation, your mitochondria go into low power mode or simply die off. This leads to a vicious cycle of degeneration. Research has shown that intermittent hyperoxia, the kind of oxygen spikes we create during EWOT, can actually stimulate mitochondrial biogenesis, the creation of new mitochondria, and improve the efficiency of existing ones. By utilizing EWOT therapy, Sarasota residents can finally address the root cause of fatigue. We are essentially giving your cellular batteries a deep charge. In other words, this protocol isn't just another shiny acronym to throw on Instagram next to your green juice and fake enlightenment. When your mitochondria are firing on all cylinders, your body has the budget to start repairing long-standing injuries and reversing the clock on your biological age. This is the part that most biohackers and standard doctors miss. They think in silos. They give you a peptide for fat loss or an injection for joint pain and wonder why the results are mediocre. I view EWOT as an amplifier. Peptides and hormones. If your microcirculation is shot, those expensive peptides you're taking are just floating around your macrocirculation, never actually reaching the target receptors in your tissues. EWOT opens the doors. Regenerative injections. Whether it's growth factors, stem cells, or exosomes, they require a healthy oxygenated environment to do their work. Injecting healing factors into an oxygen-starved desert is a waste of time and money. Detoxification. Your detox pathways, liver, kidneys, lymphatic system, are incredibly energy intensive. By boosting ATP and blood flow, EWOT helps your body finally ship out the trash that's been accumulating for years. At ARTC, we often use the EWOT trifecta, which includes PPOT, peak performance oxygen therapy. This is a HIIT-style protocol that oscillates between high oxygen and low oxygen to trigger even more radical vascular adaptations and mitogenesis. This isn't rocket science, but it is biological engineering. If you are a human being living in the 21st century, you probably need this. But it is specifically critical for the fatigue-ridden. If you're tired of being tired and caffeine is no longer working, your mitochondria are likely waving a white flag, the slow healers. If a minor injury takes months to go away, your microvascular health is the bottleneck. The performance-obsessed. Athletes who want faster recovery times and higher VO2 max need to understand that oxygen is the ultimate legal performance enhancer. The aging truth seekers. If you're serious about age reversal, you cannot ignore the fact that aging is, in many ways, just a slow process of suffocation. We are the first and only facility in the Sarasota and Lakewood Ranch area providing this level of integrated EWOT and PPOT capability. That means EWOT therapy Sarasota patients access at ARTC is part of a broader regenerative strategy, not a random gadget demo. We don't do wellness theater. We do evidence-based regeneration. This isn't just about feeling better for an hour. It's about restoring the fundamental biological infrastructure that keeps you alive. You can keep listening to the mainstream medical experts who tell you that declining health is just part of getting older, or you can do something about it.